All right, Dr. Bogoch, let me start with you. It seems that this vaccine has been subject to a lot of doubt. First, it was safe, wasn't safe for those over 65. Now it's temporarily paused for those under 55. Is this thing safe?
Yeah, I mean, I think we can make decisions based on what we know right now. And obviously, there's been some very preventable communication gaps with this vaccine. But of course, when it comes to adverse events, you can't ignore them. You can't sweep them under the rug. You always got to take them seriously. Doesn't matter how rare they are, you can never ignore them. And I don't think it's an answered question what the true incidence of these blood clotting events are. But it still does appear to be rare. It does appear to be clustered in younger cohorts, and in particular younger women. I think the move by NACI today was very reasonable to say, you know what, over 55, we'll give it. That's very reasonable. I think it's very safe with that messaging, and I hope people continue to take it in the over 55 crowd.
But Dr. Sharkawy, first they weren't sure if it was safe for over 65. Now it's over 50, under 55. It might not be safe. I mean, the window of who gets this between 55 and 65 seems to starting to get a little narrow here. But what do you make of this? If the concern is so minuscule, why take this kind of remarkable step and temporarily pause it?
Well, I think the key word here is serious. The reactions that are reported with these clots are very serious. Even though they're extremely rare, you've got upwards of a 40% mortality rate that has been reported when these events hit. These are not ordinary blood clots. They can cause very serious disease in the brain, and they can be fatal. So as Dr. Bogoch says, even though they are extremely rare, they're very serious, and it begs an explanation, it begs an investigation to make sure that if you are going to roll it out, potentially over a scale of millions and millions of people, you certainly don't want to put them in harm's way, even if it's rare, if it's something that is preventable.
But Dr. Bogoch, they're rolling it out in the millions and millions in the UK right now. They've been doing that for months. They're not stopping it. Why should Canada?
Yeah, I think you're going to have, like anything else, lots of different people looking at the exact same data and coming to different conclusions. We've only seen that happen about 8 trillion times during the course of this pandemic. I think it's interesting to note that other countries like France, for example, a few days ago took the same steps that Canada took today. And they've said, you know what, we're going to give it to 55 plus. And again, like, data is moving really quickly. The pace of scientific discovery is extremely fast during the course of this pandemic. And we have to see policy align with the data. That means policy is going to change in real time. But that also means that it has to be communicated in an honest, in a fair, in a skillful manner that really ensures that people have the utmost confidence in the policy measures. In this case, that AstraZeneca is okay for people over the age of 55.
I guess so, but Dr. Sharkawy, you got the Premier of Ontario, I'm quoting him saying he's not going to, quote, roll the dice on AstraZeneca. That basically, you see a leader like that essentially justifying vaccine hesitancy. I don't blame him. I mean, I don't know who's communicating this or what the data is, but when a premier of the largest province is saying this is a dice roll, doesn't that contribute to anyone saying, you know what, I don't trust this vaccine anymore?
Well, I can't speak for the premier, but perhaps, he wishes he could have chosen a different set of words or a phrase to depict the situation. The reality is, as you've said, this is a vaccine that by and large used in the millions, even in the UK where it was devised, and has saved millions of more lives potentially than any that have been cost. I don't think it's rolling the dice. I don't think that we are being haphazard about this. I think we're seeing data evolve. And as the data evolves, we have to be responsive to that. And if there are alternatives that are going to keep people safe, particularly within a certain demographic, in this case, it appears to be young women, we've got to explore that opportunity to maintain public trust. That's critical.
Okay, but Dr. Bogoch, you're on the task force. The premier is saying, I'm not going to roll the dice. Don't you think, he said, I'd rather wait a couple months and take the AstraZeneca or Moderna. They're more effective. They don't have any of these issues. Don't you think that reflects what most people say? Like, you know what? I'm going to wait for Pfizer or Moderna. I don't want to, quote, roll the dice on AstraZeneca. What do you say to that?
You need skilled public health communicators here, right? I totally agree with Dr. Sharkawy's comment that this vaccine has saved countless lives. I mean, it's been given to tens of millions of people during the course of a pretty rough time in many parts of Europe and the United Kingdom. Like, it really has the potential to save lives, and it has done so, and it will continue to do so. I think if we use it appropriately, especially now in those over the age of 55, it can really do a lot of heavy lifting here in Canada. But again, it's not going to work if nobody takes it. And this is where we really have to build trust, or for lack of a better word, rebuild trust in this vaccine. There's been some very preventable communication gaps with this from the company and from different measures that have been taken. But again, you can't ignore these adverse effects. You just have to put them in the appropriate context and move forward. And I think that's going to be an uphill battle from a communications front. But here we are. Let's do it.
Okay, Dr. Sharkawy, just last thing on this before I get to what's going on in BC. What are they looking for now? Could this temporarily halt be days or could it be months?
I think it's unlikely that it's going to be months. The data is rolling in very, very quickly because, as Dr. Bogoch has pointed out, there are still lots of countries that are using this vaccine, and that's probably good so that we can compare what's going on and we can identify whether this signal continues to grow. And if it does continue to grow, then I think it solidifies our answer in terms of who potentially is at greater risk, shouldn't get it. I doubt that it's going to be more than weeks, to be quite honest.
And Doc Bogoch, if someone's out there watching this and go, wait a second, I was told it was safe, I've just got it. Should they, if you've had the AstraZeneca vaccine, should you be worried right now?
I think it's important to remember that these adverse events are extraordinarily rare. We haven't even seen them in Canada just yet. And it's important to know that they can exist. And it's important to recognize that, if it is going to happen, it tends to be 4 days after the vaccine. Some people presented with headaches. We saw some classic rash that can be associated with low platelets. Healthcare providers know exactly what to look for. There's been communication to healthcare providers on what to look for. But again, let's put it in the appropriate context here. It can happen. It's just an extremely, extremely rare event.
Right.
Can't ignore it. You have to be aware of it, but it is rare.
Right, but still, they're still pausing it, and we're going to set to get out 1.5 million doses tomorrow. Dr. Sharkawy, just before we went to air, British Columbia's chief medical doctor, Bonnie Henry, basically said BC is going into a circuit breaker lockdown, canceling indoor dining, canceling worshiping indoors, telling people only travel for essential reasons, closing down big ski resorts like Whistler, Blackcomb. Is that something we're going to see now across the country? When BC's heading into circuit breaker lockdowns, is that something that Ontario, Alberta, Saskatchewan, we're going to see across this country?
I think it's entirely conceivable. I mean, I think BC is facing a bit of a unique challenge in that they're also dealing with a P1 variant from Brazil that seems to have exploded there disproportionately compared to other parts of Canada. But listen, the rest of Canada is not doing very well outside of the Atlantic and the North. So we better be prepared for the possibility that if these variants continue to spread as they are, and our healthcare capacity continues to be burdened the way it is right now, it's very likely that we're going to see some form of restriction get a lot heavier.
Okay, by the way, docs, I know we got to go, but AstraZeneca is just sending us out a response to Canada, and I'm going to read it to our viewers and to both of you. This is AstraZeneca's response following today's recommendation. They're saying, we respect the decision by the National Advisory Committee on Immunization on their advisory board. Health Canada guidance remains unchanged and provides recipients valuable, they say, information on the signs and symptoms following to monitor. But they say regulatory authorities in the UK, the European Union, the World Health Organization, and Health Canada have concluded the benefits of using our vaccine to protect people from the virus significantly outweigh the risks in all adult groups. And they point out that tens of millions of people have now received our vaccine across the globe. The extensive body of data from 2 large clinical data sets and real-world evidence demonstrates its effectiveness, reaffirming the role the vaccine can play. So, Dr. Bogoch, any reaction? They're saying it's safe.
Yeah, I mean, I totally respect that comment. I just think that when you're looking at who should get this vaccine, I think it is fair to say that it should certainly be in those over the age of 55. They are saying it's safe, and they're not wrong. I mean, they're completely not wrong. These are rare events. And again, it just goes to show you that you can have multiple people look at the same data and come to different conclusions. A lot of this is a value judgment based on evaluating the same data. And it happens all the time. It's not restricted to this. It's not restricted to COVID-19. We see this in science all the time. Your policy is going to align with the value judgment that's driven by the data. We've seen Health Canada, we've seen NACI's, we've seen what the provinces are doing. I think it's totally reasonable, but at the end of the day, we've got to build confidence in this. Looks like the provinces are going to go with 55 plus. I think that's very reasonable and a smart approach.
Okay, that's breaking news. What I'm going to do is I want to thank you, Dr. Isaac Bogoch. Great to have you on the program. I know Dr. Sharkawy is going to join us later on the press gallery. I'll even give you a moment to read what AstraZeneca is saying so you can actually process it, because this news is breaking, and we'll bring back Dr. Sharkawy to give us some more perspective on that. Doctor, always great to have you both trying to sort through the confusion and anxieties that people feel. Thanks, both of you.